I mean, that's. Good morning. The subcommittee will come to order. Today we meet to mark up a total of 10 pieces of pending legislation, all of which were discussed during last week's legislative hearing. In accordance with the committee rules, the subcommittee has reached out to the Congressional Budget Office seeking informal preliminary cost estimates for each of the bills on today's markup agenda. However, to date, these cost estimates are still pending. It's my intention to forward all of these bills to the full committee this morning with the understanding that all estimated costs will be fully offset during a future full committee markup or prior to consideration on the House floor. I now yield to Ranking Member Brownlee for any opening comments she may have.
Thank you, Mr. Chairman, and thank you for holding this committee hearing bright and early this morning so that we can get a lot done today. I appreciate it very much.
You're very welcome.
We have a number of really great bills on the agenda for today, and I want to thank my colleagues for offering legislation intended to improve the VA, improve veterans' access to health care, and even address the opioid epidemic. I'm pleased that my two bills, H.R. 91, the Building Supportive Networks for Women Veterans Act, and H.R. 95, the Veterans Access to Child Care Act, are being considered today. We heard from the VA and our VSOs last week that the pilot program offering counseling at a retreat for women veterans has been so successful that VA would like to expand the program to even other veterans. We cannot allow this pilot program to expire when the data shows that this program significantly improves mental health, with a reported 84% of women veterans experiencing a decrease in stress-related symptoms 2 months following these retreats. My bill will make this overwhelmingly successful program permanent, and I'm also pleased that H.R. 95, the Veterans Access to Child Care Act, is being considered. This bill will break down one of many barriers that prevent women veterans from receiving VA health care. Our VSOs and veterans know that the lack of affordable child care can be a significant barrier, especially for women veterans, when child care in some parts of this country can cost over $20,000 a year. You okay, Annie? Okay. Many women veterans must choose between caring for their children and getting the health care they need. This bill will give the VA several options to provide child care for veterans. VA would not be forced to have child care at every VA facility. VA could contract directly with a child care provider or provide a veteran with a stipend. I urge my colleagues to support these bills, and I support passage of all bills on the agenda en bloc. Thank you, Chairman Wenstrup, and I yield back.
Thank you. And seeing as no amendments were timely filed to any of the bills on today's agenda, I now ask unanimous consent to consider the following en bloc. H.R. 91, Building Supportive Networks for Women Veterans Act. H.R. 95, the Veterans Access to Child Care Act. H.R. 467, the VA Scheduling Accountability Act. H.R. 907, the Newborn Care Improvement Act. H.R. 918, the Veteran Urgent Access to Mental Health Care Act. H.R. 1005, to improve the provision of adult day health care services for veterans. H.R. 1162, the No Hero Left Untreated Act. H.R. 1545, to clarify VA's authority to disclose certain patient information to state-controlled substance monitoring programs. H.R. 1662, to prohibit smoking in any facility of the Veterans Health Administration, and H.R. 1848, the Veterans Affairs Medical Scribe Pilot Act of 2017. Hearing no objection, so ordered, the clerk shall report.
H.R. 91, to amend Title 38, United States Code, to make
Bills
permanent...
were circulated in advance pursuant to committee rules. I ask the reading of the bills be dispensed with. Hearing no objection, so ordered. Is there any discussion on any of the bills on the agenda? Mr. Takano, you're recognized.
Thank you, Mr. Chairman. I'm glad to be here today as we move forward with several pieces of legislation to improve the lives of our nation's veterans. I'm particularly supportive and proud to be a co-sponsor of Ranking Member Brownlee's legislation to expand and make permanent the VA's child care pilot program. Just last week, we heard from VSOs how meaningful this benefit is to their members, particularly women. Women are the fastest growing segment of the veteran population, and we need to make sure that the VA adapts to meet their needs. A lack of access to affordable child care can create a significant barrier for veterans seeking the care they deserve. But speaking of barriers to care, too many of our veterans are denied access to health care services because they have other than honorable discharges. Last month, Secretary Shulkin announced in this very room that the VA would work to expand access to urgent mental health care to these veterans. And I'm thrilled that progress is being made, but mindful that we need to be fully briefed on the details of the VA's proposal to make sure that it truly reaches the veterans who need the care the most. Congressman Kaufman's bill, the Veteran Urgent Access to Mental Health Care Act, also seeks to improve access to care for veterans with other than honorable discharges. And I wholeheartedly support the intent of this bill, but hope that this committee will continue to have thoughtful discussions with veterans and the VSO community to ensure that we are going about this the right way. Now, I understand that the VA is scheduled to brief the committee in the near future about its plan to expand access to mental health care. It is my hope that after this meeting we continue to evaluate this legislation to ensure that it enhances and complements the work being done at the VA, and it doesn't restrict or narrow access to care for veterans. I'd like to thank my colleagues on both sides of the aisle for their hard work on these bills, and I yield back.
Mr. Takano, do you have comments, Ms. Gustin? Are you sure? All right. Since there are no more comments, and since no amendments were timely filed, the question now occurs on the 10 bills on this morning's agenda. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it. I now recognize Ranking Member Brownlee for a motion on forwarding these bills to the full committee.
Mr. Chairman, I move that H.R. 91, H.R. 95, H.R. 467, H.R. 907, H.R. 918, H.R. 1005, H.R. 1162, H.R. 1545, H.R. 1662, and H.R. 1848 be forwarded favorably to the full committee.
All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and our 10 agenda items are favorably forwarded to the full committee. In summary, the subcommittee has voted to forward the following 10 bills favorably to the full committee. Once again, H.R. 91, H.R. 95, H.R. 467, H.R. 907, H.R. 918, H.R. 1005, H.R. 1162, H.R. 1545, H.R. 1662, and H.R. 1848. My sincere thanks to all my fellow subcommittee members. I thank you for being here this morning. Ranking Member Brownlee in particular, and the sponsors of the bills that we're considering this morning. Without objection, the subcommittee staff is authorized to make any technical, clerical, and/or conforming amendments as may be necessary to the bills favorably forwarded to the full committee today. Hearing no objection, so ordered, the meeting is now adjourned.